I'm Dr. Laureen Rubino. I am a surgeon doing laparoscopic surgery. Laparoscopic surgery is when we use very small incisions to put cameras and instruments through to the body to view and to dissect the area of interest. We use it for hernias, gallbladders, colons, all different types of defects that patients have in abdominal walls. And sometimes they're even exploring things like thyroids. In addition to laparoscopic surgery, I do robotic surgery, which is a specialized type of laparoscopic surgery at ECHN. And ECHN is an epicenter, which means we're a teaching facility for other surgeons, other people who are doing laparoscopic surgery and want to fine-tune their skills and use a computer to help them do their surgeries. Robotic surgery is taking laparoscopic surgery, which uses a camera and these very specialized instruments, and making it 3D so you could visualize the anatomy much better, and then wristing instruments so that you can actually bend them just like your hands and almost use fingers to dissect out certain structures that sometimes were very difficult to dissect out with the laparoscopic instruments because they were just straight type of instruments and they weren't wristed. So the robot, with the assistance of a computer, allows us to magnify the anatomy and then to dissect it out very precisely. So it's a precision type of laparoscopic surgery. And at ECHN, the surgeons have been trained, including myself, to do this on a number of different procedures. The one that it's used on the most is gallbladder surgery and hernia surgeries, which include ventral hernia surgeries, which can be quite large and quite involved, and this is a wonderful technique to use to dissect those structures out. Well, the benefits are patient comfort. This is definitely patient focused. They have very small incisions and sometimes just one incision. And the safety for the patient is our paramount concern and goal. So because we can magnify, because we can see so much better, we think that we can definitely make a difference in the amount of injuries that patients will have in the operating room and reduce that significantly. In ECHN, we have done the most number of ventral hernia repairs in New England. We have, I think, the third highest in the state of Connecticut for gallbladder surgeries. And we have done numerous courses and sessions for training other doctors. I think it's important to discuss who is a candidate for traditional laparoscopic surgery and who's a candidate for robotic surgery. Basically, they coincide and they pretty much are the same person. So most people are a candidate for robotic surgery and do very well after the procedure, as well as our traditional laparoscopic cases. The thing about the robot in using computer-assisted surgery is that their incisions sometimes are less, or they're not as many as when we do laparoscopic surgery, traditional laparoscopic surgery. When we see patients in my office for a consult, we will discuss with them the advantages to traditional laparoscopic surgery and robotic surgery. And usually, patients understand the differences when we explain that computer-assisted surgery is 3D and it has wristed instruments, and it's somewhat like going from a regular TV program to a high-definition TV program. So with that, we come up to a decision of what they think would work best for them. We would be happy to discuss any questions that someone has, and we have a whole team of people here to help someone come up with a decision for surgery. My physician assistant and myself work very hard to educate the patient and come to a decision for their process.